you're not really sure what to say. You're like, oh, hey, I'm an immigrant. Can I please have some free health insurance or free health care? And they were actually pretty nice people. And it's like, you know what? Doesn't matter race, religion, creed, ethnicity. You are entitled to health care. You're a New Yorker. You're entitled to health care. And that's when I was introduced. I had a great caseworker who put me on to Dr. Jimenez over at Cumberland. And from day one, having someone that you can be honest with about how you're feeling and your physical condition, and having them direct you in the right way, not just with eating and with medication, but showing you like, you know what, you do belong here. You are a part of what makes, New York so great. And I was baffled. I was like, wait, there's gotta be some catch to this, man. I'm telling you, I'm gonna get free meds, I'm gonna get to see a doctor on a regular basis, and the people, NYC Healthcare really brings back the human factor. I mean, I wasn't a number. I had people call me and check up on me and was like, Wendell, how are you feeling? You have a doctor's appointment scheduled. It wasn't a recording calling me. It was a human touch that makes this program so extraordinary. And I'm glad to say, hey, my birthday is coming up this month. And I know personally, if it wasn't for NYC Healthcare, I might not be here. Like some of my friends who passed away from hypertension, who did pass away from diabetes, who did not know that because of their status, they can still get affordable health, could still be a part of an affordable program that can provide health insurance, not health insurance, but can provide them with what they need to just be healthy, to just be a healthy New Yorker, so that I can pursue other things. So I want to thank Dr. Jimenez, I want to thank Mr. Katz, I want to thank the commissioner, and thank NYC Healthcare just all in general for just letting people know that, you know what, you are a part of New York. Once you're here, you're a New Yorker, and you are entitled to all the care and benefits that a New Yorker deserves. And thank you, and I'm glad to still be alive.
Thank you. So now we are gonna start the Q&A part. I'm gonna be calling the reporters for Q&A, and I just wanna make a comment, and we really appreciate people are on time here, because when they are doing the introduction, so we need to be on time so we can start. We're gonna finish this at 2 p.m. We have 45 minutes for a Q&A, so let's start with Sheikh.
Yeah, thank you. My name is Sheikh Drame, representing Muslim Media Corporation. The question is, what are the requirements paper-wise to be seen? Number one. Number two, who pays for the program? And number three, are there limits to the expenses incurred by the patient? Thank you.
Thank you. Thank you for your question. So there's a few pieces there. In terms of requirements, we do want to connect people to health insurance. So one of the first steps in enrolling in the program is being screened for health insurance. So we do go through the health insurance marketplace in New York State, and that has certain requirements: proof of identification, of residency, of income, of household size. That being said, we recognize that there are barriers to getting those documents sometimes, depending on who your employer is, for example. And so we do provide opportunities for self-attestation, and we really work with people to make sure they can still have access to care regardless of what documents they have available. Regarding the funding for the program, it's city tax levy, so it's really a decision we've made as a city, and supported by the administration, to really say, look, healthcare is a human right, and we're going to make sure that the funding is there to support it. And there was one last question.
Yeah, are there limits to the expenses?
Limits to the expenses. We haven't mentioned the fee scale. So every time you access services through NYC Care, New York City Health and Hospitals, you will be charged a fee. So you don't pay a membership fee like by month, but there's a fee that's according to your income, depending on your household size and income. But otherwise, there's no a cap necessarily. So anything that is available in New York City Health and Hospitals is available to NYC Care members.
Thank you, Doctor. So, Angie?
Can I add?
Oh, yes, I'm sorry.
I just want to say, because I had a chance to work with many of the newly arrived immigrants accessing this program. And also, as many of you have heard, my parents are members of NYC Care. At the first conference we had together, I thanked the Dr. Jimenez NYC Cares because, my parents continue to be immigrant. This scale, we're starting at a very, very affordable level. I don't know if you want to mention.
Yeah,
I think
absolutely.
the lowest scale is $15 a doctor's visit or something like that.
Yeah, so that's a good point. We publish our fee scale publicly, and if you live under 100% of the federal poverty level, you pay $0 for a primary care visit, $0 for a specialty care visit, and likewise $2 for a prescription. So it's, we really want to make sure that healthcare is affordable regardless of your income or your immigration status.
Thank you. So, and yeah, we're gonna do one question per reporter so we can have everybody opportunity.
Can someone bring at home test result to a test to create a site for assessment to receive treatment?
To receive treatment. So New York City Health and Hospitals has set up a hotline. There's 212 COVID-19 that you can call if you have questions, you've tested positive, you have symptoms, and you can even get access to treatment through the hotline. You'll be connected to a virtual express care as well. So, yeah.
Thank you.
En español, por favor, ¿puede decir cuáles son los requisitos de las personas para obtener el cuidado de salud, servicio de salud?
Sí, el requisito principal, bueno, hay varios, pero primero tiene que vivir en la ciudad de Nueva York, ser residente, aunque sea un día haya decidido hacer su hogar aquí. Y también tiene que ser inelegible para el seguro médico o que el seguro médico que sea accesible para usted sea de un precio muy alto. Entonces esos son los dos requisitos principales.
Y explicaste los del income, los del estado de...
Bueno, esos son documentos que se requieren para poder verificar que usted no tiene acceso al seguro médico o que si tiene acceso a un seguro médico que ese seguro sea muy, muy caro para usted. Entonces por eso se necesitan esos documentos. Pero como le dije, no quiero que a nadie le dé miedo venir a buscar cuidado porque le haga falta un documento. La importancia es que vengan, visítenos, llamen al 646-692-2273 y nosotros trabajaremos con ustedes para que puedan acceder al cuidado que necesitan.
Hold on un momento. Rico?
Yes, Rico to Prefab Radio Solar. Is there an urgency component to being accepted? Because I have someone who called me on the radio telling me, well, she was complaining of having stomach issues, some stomach problem. And I said, well, use NYC Care. And she said, well, she called and they're saying that it's not urgent enough, something to that effect.
Yeah, no, there is no urgency requirement for NYC Care, and in fact, there is no income requirement either, right? So our fee scale goes all the way up to 500% of the federal poverty level, and then beyond that, we also will bill you at whatever Medicare bills. So, yeah, I mean, I think if you ever encounter any situation like that, feel free to reach out to me. We can make sure, yeah, absolutely, people get the care they need. So.
Well, can I just add something?
Yes.
And it's important, and I'm sure Dr. Jimenez agreed. If it feels urgent, it feels like an emergency, they should visit the hospital, NYC Care Gotham Center. The phone is not for a consultation, right? And even if you look at a list of eligible or services you can receive, people should go to the hospital and should go to the Gotham Health clinics to get an assessment. And I want to say this because this was the case for so many of the newly arrived immigrants that I work with. They're afraid of going to the emergency room because they think it's going to cost so much money. Mm-hmm. Well, that's not necessarily the case when you're enrolled in NYC Cares and in the health and hospital system. So they should attend. You don't want to end up being taken by an ambulance. You should go regardless, whether you think it's an urgent or not matter. If it feels like an emergency, you should go.
Absolutely.
Amanda?
So can you speak a little bit about why there was a 6-month requirement in the first place, and then what prompted or how it was flagged for the city to then get rid of that, and why that's important? You talked a little bit before, but just kind of explaining that process. Thank you.
Sure. I can say that the administration wants to send a clear message, especially to immigrants, right? Because we understand that so many newly arrived immigrants come here every day, that the moment you arrive, you don't have to wait for medical assistance, right? Especially when you're fleeing crises such as the Ukrainian crisis. And once we Dr. Jimenez, myself started to listen to what specifically immigrants were saying, that it just didn't make sense for us to have them wait that long. And of course, we're working to make sure that New York City services are completely accessible to immigrants and really all New Yorkers. And we started with regardless of immigration status, now we're taking it a step further and saying the moment that you're in New York, you're a New Yorker. So can I just say this in Spanish just so that para que practique mi español? Quiero decir que eliminamos la necesidad de vivir 6 meses en Nueva York para acceder a este programa, porque queremos mandar un mensaje muy claro a la comunidad inmigrante que en el momento que esté usted aquí en Nueva York, usted es un neoyorquino y puede tener el acceso a el cuidado de salud. Y es importante no solamente decir que esto es accesible a pesar de cualquier estatus migratorio, pero también ahora a pesar de cuánto tiempo tenga viviendo aquí en Nueva York. Así que no es necesario esperar los 6 meses, ahora puede acceder a este programa el primer día. Y esto es a causa de tener, honestamente, representación de hijos de inmigrantes o inmigrantes en una administración que busca que nuestro liderazgo sea reflejado, ¿no? Y parezca a la población de la ciudad de Nueva York, que es 60% inmigrante e hijos de inmigrantes. Así que nos orgullece mucho poder hacer esto por nuestras comunidades, especialmente los recién llegados.
Gracias. Seguimos ahora con División.
Podemos cerrarnos en División para cualquiera de los dos en español, por favor. Entendemos que ahora con lo de los 6 meses cambia, pero ¿cuál sería la diferencia entre, por ejemplo, un turista y un inmigrante? ¿Cómo ustedes trazarían esa raya? ¿Cómo les pedirían dirección? ¿Qué serían los documentos que tendrían que llevar para poder identificarse que realmente es un inmigrante que llegó a trabajar a esta ciudad y no simplemente un turista?
Sí, pues nosotros todavía, como he dicho antes, requerimos que tenga documentos, ¿no? Como, por ejemplo, no documentos de inmigración, sino documentos como sea el contrato de alquilar el apartamento, o un correo que le haya llegado con la dirección y su nombre. Esos documentos se los pedimos, y si no, tiene que firmar que de verdad reside en este país, ¿no? Ahora, también sé decir que a pesar de... Nosotros en New York City Health and Hospital siempre hemos recibido a todo el mundo. Ahora, aunque no pueda inscribirse necesariamente a NYC Care, puede acceder al cuidado médico a través del sistema.
You mentioned that there are more than 1,100,000 members covered by NYC Care. Do you guys have specific data in public?
Yeah, we have several figures. For example, we know that about 60% of our members prefer to speak Spanish, another 30% English, and then we have about 1 to 2% speak Russian, Chinese, and Mandarin, Cantonese, for example. And then, of course, the diversity of New York City is well represented among others as well. And in terms of demographics by age, the majority of our members are between 30 and 64 years of age. And yeah, I mean, we're happy to share other specific figures as well. Yeah, absolutely.
This is Sarah from NYC Care. So I have a question about, because a new fiscal year started, when are you planning to start the program of healthcare to provide undocumented immigrants of 65 years and older?
I assume you're referring to the expansion of eligibility, right? I believe that's set to start in January, and we're working closely with the Mayor's Office of Immigrant Affairs, the Department of Health and Mental Hygiene, just to make sure that whoever's eligible, newly eligible for health insurance in New York State will get access to that health insurance.
Can I just say something? I actually, this is an important question. I'm very proud to belong to an administration that advocated for all New Yorkers, regardless of their immigration status, to have access to healthcare at the state level. So we're leading the way here in New York City, but we want to make sure that all New Yorkers in the state have access to medical care. And so a number of months ago, Dr. Jimenez, myself, Dr. Katz, our commissioner of the Department of Health and Mental Hygiene put out a statement in support of New York Health for All. And we know that those 65 years and older will be able to access health insurance sponsored by the state, but we want to see more people included in this program. And we're very proud to be working with Mayor Adams, who understands this issue, and we're going to be pushing for all people in New York to have access to health.
You mean Medicaid?
Yes.
Castaño.
Javier Castaño from Queens Latino. Just to explain our readers, let's say that a new immigrant from Central America just comes here to this country, but they don't have, to the city, they don't have a cellular phone to call 311 or whatever, or they do not have access to the internet, or they are afraid. That person, what can that person do?
Yeah,
Where the person can go, or whatever.
Yeah, so I think that they can go to one of our facilities, our healthcare facility. We have financial counselors there who speak many different languages and also have interpretation available through.
What facilities are those? Public hospitals?
Yeah, New York City Health and Hospitals. We have 11 hospitals, 56 locations across the city, and that's a great way. Another way, recognizing that a lot of people do have fear to come to government establishments, they can also go to our community-based organizations. We have 22 that we work with closely to make sure that we get the word out about the program and people can go to a place they feel comfortable to learn more about the program and even enroll. So. Okay. No, solo que para acceder al programa pueden ir a una de nuestras clínicas hospitales, pero también pueden ir a visitar a uno de nuestros colaboradores en la comunidad. Hay muchas organizaciones sin fines de lucro que están trabajando día y noche para asegurarse de que la comunidad inmigrante sepa que tienen derecho al cuidado médico, y también pueden acceder al programa a través de ellos que están haciendo ese trabajo, inscribiendo personas todos los días.
Okay. Y si puedo decir una cosita específico. Estamos hablando de los hospitales de la ciudad como Elmhurst Hospital, ¿no? Que está ubicados en la comunidad, o las clínicas Gotham Centers, ¿no? Por ejemplo, la que está ubicada en Jackson Heights, muy cerca a Gotham Hospital, o organizaciones como Voces Latina, Make the Road y NICE, que trabajan junto al Dr. Jiménez, NYC Care. Así que la comunidad inmigrante ya las conoce. Queremos asegurar que conozcan la eliminación de estos requisitos, que van a ser más accesibles para la comunidad inmigrante recién llegada.
Okay, El Hari.
Yes, thank you, Jose, for putting this together. Commissioner, how are you?
Hello.
I'll come a little bit late, so I don't know if the question I'm about to ask has already been asked. We remember Mayor Adam during the campaign, said a lot of things that is happening, because here we are today. With the previous administration, yes, we was in contact with them, but not as much as it is now. Now the question is this: the ID NYC is on already. It's been on, but I'm getting a lot of complaints. People saying that they're making it hard for them. So I don't know what you guys are trying to do. You can ease it up for the immigrants. We all know that New York City is a safe haven for immigrants. So people are asking us those questions. What you guys are about to do for the ID NYC to make it easy for them to get access to it. The other thing is real quick, is like our citizen, the senior citizen. Most of them now want to retire or want to go back home. Is there anything that you guys are working on that? On top of that, the rental is kind of expensive for us. What can you do about it?
We're talking about NYC Care today, so maybe if you can just give a brief about the ID NYC, because we're planning a round table about ID NYC for the next 2 weeks. So, and all of you are going to receive the invitation for that, and we hope to see all of you here. But just briefly, because we can go to the next.
Just like what we're doing here today, we're taking a look at all programs that impact immigrants. We're committed to improving those. With ID NYC, we're reopening sites that closed due to COVID. But as I said, like this program, we're looking at everything, making sure that we're improving things for all New Yorkers, but specifically immigrants, right, that use these services. And as Jose said, we're going to do something around ID NYC, and we'll continue to do the same with other programs. So, no, well,
And for the senior citizens?
Well, let's follow up on that.
Thank you.
Okay.
Hola, soy Carolyn Pimentel del programa El Corazón de la Medicina. La dentadura es parte esencial de nuestro cuerpo de la salud. Ustedes planean cubrir esta parte, claro está que sí lo hacen, pero hay jóvenes que pierden sus dientes a temprana edad y no pueden pagar un alto costo para recibir un nuevo trasplante.
Sí, los miembros de NYC Care pueden acceder a cuidado dental también a través del programa y pagar los mismos precios que pagan para otros cuidados médicos. Sí.
Pero si reemplaza un diente. Sabemos que un diente cuesta hasta $3,000 y $4,000.
Sí, no sabría decirle si exactamente ese servicio, pero sí hay cuidado de dentista a través del programa y nuestro sistema.
Hi, this is Tintin with NTD. We just want to know, is it required they have to provide address, or like how do you deal with, or you will worry about that outside of the New York State, the people will come in here to join the NYC Care?
Yeah, I think that we do ask for documentation of the proof of address, so there's a lot of different proof that you can provide. And if someone is fearful about sharing their address, they can offer the address, for example, of a community-based organization or the clinic that they visit, so that we want to make sure also that they get their membership card and their membership manual at the address that they locate. So.
How do you deal with the
That's right.
How about out of the New York State? Do you worry about the people coming in and then this program overload?
Well, we haven't seen, we've reached over 110,000 members, but based on our estimates, we haven't seen that we're overloaded. And what I'm hearing from the community, in fact, is that there are a lot of people that still are afraid to get the care that they need. They've lived in New York for a long time and didn't know that this program existed. And so we're excited to be here to share the news with you.
Yes, right here. Sir, you asked me for a question. Oh, okay. Let's go over there. In the back.
Filipino American Press. So, where do people apply for it? And then do they renew it? Does it expire? And will you be translating to local languages? The mayor's program also wants to encourage that Tagalog, Filipino, and others. Thank you.
Yeah, great question. So to enroll in the program, you can call the hotline, so 646-692-2273. That's one of the best ways. You can also visit one of our 22 partner CBOs like Voces Latinas, Make the Road New York, many others that you can find out about at nyccare.nyc. There's a list of community-based organizations. And you can also visit our hospitals and clinics, of which we have 11 hospitals and 56 different clinics across the city.
Okay.
On language access.
El Diario. Oh, I'm sorry.
Just to say something on language access, it's important to know for the immigrant community to know that language access is a priority, right? But we're going further. We want to say that not only is it a priority, but it's the law. Local Law 30 says that all New York City services need to be provided in your preferred language. Not if you speak English, we're gonna help you in English, in your preferred language. If you speak English but you prefer another language, that is a language that we're going to support you and work with you on. Even if it's a language line, although we're working to hire more people who are linguistically and culturally competent to provide services. And we're taking it a step further. We want to hear from New Yorkers. If you come across an issue, call 311 and let us know your feedback. Because 311 will then let us know, the administration, the mayor's office, what is going on in the clinics, at any government service, so we can make the adjustments that we need to make.
Okay, El Diario.
Hola, es Luis Martínez del periódico El Diario, eso va para los dos. Es evidente que la administración está haciendo un cambio y está tratando de cubrir estos servicios médicos para más inmigrantes, pero al mismo tiempo esto va a generar más costos, porque ustedes van a tener que trabajar más. Conozco personas que dicen que llaman a pedir una cita y se demora, especialmente con el tema de especialistas, con temas gástricos que pueden durar hasta 3 meses. ¿Cómo van a manejar ustedes eso para garantizar que estén dando un servicio más amplio, pero de calidad y no se reduzca la calidad. Y si creen que el presupuesto pues, que tenemos ahora para este próximo año fiscal es suficiente o se van a ver ustedes un poco cortos en los fondos.
Bueno, pues cada año miramos cuánto nos está el costo del programa para asegurarnos de que tengamos los fondos y seguro que vamos a estar en discusiones para asegurarnos de que tengamos el apoyo que necesitamos para que no se pierda la calidad. De parte mía como doctor médico yo he visto pacientes y con orgullo poder decir que alguien, un miembro de NYC Care pueda recibir cuidado urgente. Si necesita ver un especialista dentro de un mes, se le recibe. Y se le atiende cuando se necesite. Así que a veces va a haber demora porque depende del especialista, pero en general estamos muy orgullosos del cuidado que estamos proveyendo y tenemos muchas historias. Toda mi familia va a New York City Health and Hospital y están felices de recibir el cuidado que reciben.
O sea, los fondos están siendo suficientes.
Sí.
Bueno, y para añadir, a largo plazo económicamente es mejor, ¿no? Porque, como lo ha dicho el doctor Jiménez, en vez de ir y acudir a los cuartos de emergencia, ya cuando es muy tarde tal vez, es más costoso para la persona y para el gobierno. Así que el cuidado preventivo es a largo plazo mejor, ¿no? Económicamente o presupuestalmente, para la ciudad y para la persona.
Sí,
así que queremos que la gente acceda a estos cuidados médicos ya.
Y como médico, pues disculpe, sino es que como médico, esto es tan importante lo que dice, porque no es solamente el dinero, sino que si usted va a la sala de emergencia para que le cuiden la diabetes o la presión alta, es muy tarde. Usted tiene que hacerse cuidar con su doctor primario, que tenga todo controlado, calmado en su casa, recibir sus medicamentos cuando lo necesite y ya, no tiene que tener necesidad de ir a la sala de emergencia.
Hi, Mr. Castro. Thank you very much for inviting us, and this is a very important topic you are addressing. There is a confusion. My name is Kaushik Ahmed. I publish weekly Bengali newspaper for Bangladeshi community. You know, there is a confusion in our community that those who are undocumented, you know, they will not get any treatment if they have heart attack or the kidney transplantation or this type of big things. You know, so can you address this question, please?
So this is why we're here. So I'm so glad that you brought that up, right? We're here because everyone needs to know that if you live in New York City, you have access to care. If you have a heart attack, you should not be afraid to seek care. If you have hypertension, if you have diabetes, if you have a stomachache, you should not be afraid to seek care. And that's, I mean, the most important message that I want everyone to get from this, and I appreciate your assistance in that. And that's why we're, removing the 6-month residency requirement, to make sure everybody knows. Yeah.
And to add to that, and thank you for participating in this press conference. We want to make sure that all immigrant communities are represented here. There's no immigrant community too small or too big, frankly. We need all of your support to get the word out. There's a lot of stigma, right? A lot of confusion. Right, and then there's also a lot of stigma. They hear, well, first of all, people can get confused about hospitals, right? They don't understand there's private hospitals, there's government hospitals, and then there's stigma against government hospitals because perhaps their experience in their home countries with government hospital was not great, right? So we need your support to make sure there's less confusion, less stigma, to make sure that there's quality health care available for all people regardless of immigration status in New York. And with data collection, privacy is the most important issue for us. So when you come to the hospital, we don't ask for your immigration status. We don't ask if you're an immigrant, in fact. We want to make sure that you feel comfortable and that you feel safe coming to see Dr. Jimenez, see other doctors in our clinics. So that's the key message here, but we need your support.
Okay, so thank you. Hold on. Okay, ¿lo quieres decir en español?
Bueno, ok, muy bien. Queremos que el mensaje sea muy claro. Hay mucha confusión y también estigma. Hay muchas diferencias entre hospitales. Hay hospitales privados y hospitales de gobierno. El mensaje hoy es que hay hospitales de gobierno que existe cuidado de calidad, donde pueden ver al doctor Jiménez y a otros doctores que les importa mucho a nuestra comunidad, que no les dé miedo, que no les digan mala información, vengan por ustedes mismos, vean el cuidado que existe, pero necesitamos el apoyo de todos ustedes, ¿no? De la comunidad, de los líderes comunitarios, de los medios de prensa, para que esta información llegue clara a nuestras comunidades inmigrantes.
Okay. Queen's Daily Eagle? No. Oh, Queen's Daily Eagle, and after you, I'm here. Okay.
Hi, I'm Jacob with the Queen's Daily Eagle. For Dr. Jimenez, on the test and treat program, you know, with the elimination of the color-coded risk system and the rollout of the test and treat mobile vans, I'm wondering, you know, if you could speak about it seems like there's this expectation that New Yorkers no longer should be assessing the risk for participating in activities that could potentially get COVID. You know, is that what New Yorkers should?
So I'm not as familiar, I would say, with the color coding risk stratification system. I think that's our colleagues at Department of Health and Mental Hygiene. And is that, I know that from test and trace core perspective, you know, we want to make sure everyone has access to testing, which is, you know, why we've handed out over 33 million different at-home testing kits, and we'll continue to make sure we expand access to testing and now treatment through the new units. So.
Yes, in the back over there.
Hi, I'm Rong Xiaoqing. I'm a reporter from Xinjiang Daily, Chinese language newspaper. If I didn't get you wrong, you said among members there are more than 60% people speaking Spanish and only 1 or 2% speaking Chinese. Is there any reason you think that Chinese speakers are so disproportionately low among members?
That's a good question. I, you know, aside from the barriers that immigrants usually face, we've heard from our community-based organizations, many immigrants are afraid to seek care, and so that's part of the project of being here and making sure that we get the word out, not just in the Spanish-speaking community, but in the Bengali-speaking community, in the Chinese-speaking community, every single ethnic enclave and community neighborhood in New York City. So.
Hi, Jimenez. Okay, so someone may have already asked this question. I'd like to know what type of interagency collaboration there is in getting this information out to immigrant New Yorkers. For example, you know, are you guys going to be working with the Department of Education, because as a parent, there are e-blasts, there are notices via the PTAs, the community education councils, to reach parents, to reach immigrant parents, and to reach other parents who don't have health insurance? Or also, what about collaboration with, say, the various consulate generals that are here in New York City, because they too send out communications to their nationals who are here in New York City, just so that we could get the information out. So I'd like to know, you know, what is your rollout for that? What type of initiatives or engagements are you going to do to get those organizations also involved with that? Thank you.
Yes, you know, we and thank you for the great list of ideas. We're you know, in the last 6 months we've been working to meet and think through ways we can collaborate across agencies. So I've met with many commissioners, and actually this is a great example of cross-agency collaboration. Thank Dr. Jimenez for involving me in this roundtable, because this is how we best work together, right? By doing collaborative roundtables, events, not just here at City Hall, but in the community, right? So we're very much committed to working across agencies, Department of Education, but you know, all agencies really that have a contact with immigrant communities. We work closely with our consul generals. I just had an event on Friday with representatives of all consul generals and Small Business Services Commissioner. So you'll see from this administration a high level of collaboration, because we know that doing things together is when we perform the best. And so this, I hope you see as an example of that.
Yeah, Option TV.
Okay, Roberto Garcia, Option TV.
Dos cosas. ¿Hay algún plan para quitar el estigma que tienen los hospitales públicos con respecto a los privados? Porque mucha gente no sabe cuál es un privado y cuál es un público. Y si hay alguna cosa que te impida o le impida a alguien entrar en el programa.
Bueno, en cuanto al estigma, yo creo que este es parte de eso, ¿no? De eliminar eso y decir claramente, bueno, yo nací en el hospital de Elmus, todos mis primos nacieron allá, como les he dicho, mi familia continúa recibiendo cuidado médico en New York City Health and Hospitals y estamos aquí para servirle y mandar ese mensaje fuertemente a través de todas las comunidades. También, disculpe, ¿cuál es la segunda pregunta?
Si hay alguna condición que te impida a alguien acceder a...
¿Condición médica?
Médica o económica, social, un requisito.
No, el único es que si usted tiene acceso a seguro médico, bueno, entonces lo vamos a inscribir al seguro médico que usted tiene acceso, porque eso le va a dar más libertad, pero si no tiene acceso a seguro médico, lo inscribimos a NYC Care, eso es lo principal.
Who have not gotten a question yet? So we can do. Okay, gonna go for a sec. We have less than 10 more minutes, so we're gonna do a couple of questions.
Okay, gracias. Your comment. Pregunta acerca del test to treat, que no pude captar más información. ¿Puedes hablar acerca de cuáles son the latest de test to treat ahora mismo en Nueva York?
Yeah, so last week we announced that we were starting a test to treat program with 3 units. This week we're up to 10 units that are both testing people with rapid testing and PCR immediately, and then also evaluating them if they have symptoms, and if they have treatment and they're eligible for treatment, they'll get a prescription to their local pharmacy, in some cases with the pharmacy across the street, so that they can get their medication immediately. La semana pasada anunciamos que comenzamos el Test to Treat Program, que significa que en las unidades móviles donde proveemos pruebas también va a haber tratamiento accesible. Así que le mandamos la receta, si usted es elegible para el medicamento, a su farmacia local, o sea, ahí mismo cerca de la unidad donde recibió la prueba, para que todos tengan acceso no solamente a las pruebas, pero también al tratamiento si es necesario.
Okay, before we go to the next one, any question for Wendell Wells here? Because we have a patient here. Okay, great.
Thank you. So, for Wendell, so can you take us through how you applied, how you heard about it, and the process that you made, and how was it? Was it easy? Was it challenging? Just can you recall that experience?
No, it's a good question, and I think again, a lot of people are scared because, like, what is the process? And I was scared too. Like, this is gonna cost me like hundreds of bucks, you know. But I just called. I called Woodhall, which is a hospital that is affiliated with New York Health and Hospitals, and Woodhall passed me on to an amazing caseworker who like said, you know what, you don't need to be talking to me over the phone. You need to come down here like right now. And sat with her, and everything was confidential. And because you know, again, you know, there's the stigmatism of, you know, you don't really want to reveal too much information because times are crazy. But I just felt so at ease with her to let her know where I was, where I'm trying to do, where I'm at right now with my health. And she was great, man. She stuck with me the whole time, and she got me with Metro Plus, and then she got me like affiliated with Cumberland because I'm a diabetic. And honestly, the process was really simple. But because again, once you make the initial reach out, they're going to reach out to you. It's not like I have to constantly keep calling them because they want to enroll more people. They want people to be healthy. So the hardest part of the job is the initial, to just reach out. Because once that's done, you've got caseworkers who actually really care, and they're going to help you every step of the way to get the help that you need.
Okay, one last question with Amanda.
Can you spell your name for us, and also you said that you immigrated to New York 2 years ago. Where did you immigrate from?
Trinidad and Tobago.
Thank you. And can you spell your name for us?
Sure, Wendell.
Thank you. And Wells, Wells.
Correct.
Thank you.
No worries.
One last question. Okay. Oh, wait. China. I'm sorry. Vision Times.
My name is Martin from Eastern Times. I just like to know
how many people will enjoy this plan, and how much money will you spend on this plan?
Me personally?
No, right, it's just for them.
So as a program, you know, we committed $100 million a year from the city tax levy funds, and that's what's dedicated to the program. And then just at the patient level, you know, there isn't a premium. We haven't mentioned this yet, right? There's no monthly premium. There's only the fee scale that you can expect to pay according to your income, and in a way that's affordable for you.
Thank you. So Wendell, Commissioner Castro, and Dr. Jimenez are going to stick around for a few minutes. So if you want to do maybe a couple of one-on-one or something. So I want to say thank you. This is the biggest roundtable that we have had. Almost 40 reporters today. Thank you very much for your attendance today. And we are going to continue doing these events, and because we see that you respond to this and you support these events, so we're going to continue. The administration will continue doing this roundtable here. Thank you, Dr. Jimenez. Thank you, Commissioner, and thank you, Wendell, for your assistance.